your body has the ability to adapt to its surroundings, to adapt to the situations.
It is that simple. When you find a misalignment as a chiropractor, you restore its mobility, you show the patients the weak link of the spine, you really can do a lot of great things for the body.
It was completely affecting her life, and she got her life back because of the power of chiropractic.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, welcome back to the Unplugged Healthcast. This is your host, Dr. Kevin Wall. We're excited to have you back. I want to take you back to a day. The year was 1895. The place, Davenport, Iowa. There was a gentleman named Daniel David Palmer. He was a outside-the-box thinker. He worked in an office complex in those days, and there was a janitor that routinely cleaned all of the offices. His name was Harvey Lillard. The story of Harvey was 17 years prior to this day, a crate had fell off a shelf, hit Harvey in the back of the head and the neck, and somehow Harvey lost his hearing. Well, Daniel David, as he was an outside thinker, always wondered what the coincidence was. Box falls off, hits him in the neck, hits him in the head, and he loses his hearing. Well, he was very observant. He noticed many times that Harvey had a bump in the back of his neck, the back of his upper spine. And with Daniel being an outside thinker, he wondered what the correlation was. One day he took a look at his neck and he noticed a spinal bone shifted out of position, protruding out of the back of Harvey's neck. Well, logic would tell him that there must be a correlation. On that day, September 18th, 1895, Daniel David Palmer decided to move that vertebrae back to its original position. This was the beginning of chiropractic. This was the origin of the profession. On that day, he moved that vertebrae, a big pop occurred, and sure enough, Harvey started to get his hearing back. Well, as you can imagine, Daniel David put two and two together. From this experience, he started developing a theory that many health problems could be related to misalignments of the spine. He called these vertebral subluxations. They interfere with the nervous system's ability to work. He proposed that correcting these misalignments through specific manual adjustments could help restore the body's natural ability to heal. Today in our podcast, we're going to talk about the miracle of chiropractic. See, for many of you, you may have said, I don't believe in chiropractic. Well, for me, it was a lifestyle. I was born under the umbrella of chiropractic. My uncle was a world-famous chiropractor. He traveled and spoke throughout the world on the profession and the technique of chiropractic. I never really went to a doctor. I never took medication. I never needed to, because anything that occurred, my mom would take me to her brother and he would work on me. He would help me understand how to eat better and how to actually be healthy through chiropractic. See, it wasn't a belief system back then. It was just a lifestyle. For most of you, or many of you, maybe this is a brand new concept, or maybe you haven't heard of chiropractic much, or maybe you didn't believe. The great news is it's not a religion. You don't have to believe. It's based on a science, and the science is straight out of the anatomy books. We're not making this up. You can go find it today. See, the one organ in your body that controls and coordinates all other organs, tissues, and glands and muscles in your body is the brain. Your brain is housed inside of your head, your cranium, and all of the spinal cord and nerves come off of your brain going through your spine. They go to all of your body parts, all of your organs, your tissues, your glands, and your brain has one major function, and that's to control and coordinate all other bodily functions. See, if you want to be healthy, this isn't about feeling good. This is about functioning normal. We've done podcasts multiple times on functional health and functional doctors, but today we're going to really help you understand that your body is controlled by one organ and your brain has one job, and that's to make sure your body functions normal. In fact, you can test this out as we're listening here. If you don't believe me, just do a simple research. Take a deep breath for me. I wonder how you did that. Ask yourself, how did your body, your brain, did it just talk to your lungs? Move your arm, move your pinky, stand up, and ask yourself, how did I do these things? See, your brain is communicating at all moments to your body at all times to control and coordinate movement, gland function, circulation, heart palpitation, everything. So the illogical thought that somehow what Daniel David Palmer did in September 18th, 1895 was a coincidence that Harvey Lillard got his hearing back, that doesn't really take far to actually reach the science behind that. See, all the nerves in your body go to all organs. And don't get me wrong, I'm not saying the chiropractic fixes deafness. What I am saying, though, is your body has the ability to be healthy on its own, to function normally, and the nervous system is the only organ that controls that. So if you jack up your spine, if you change your spine, if you have misalignments, if you have biomechanical abnormalities in your spine, if your spine doesn't move right, doesn't sit right, if you don't stand correct, if your spine is shifted, tilted, or twisted, this is not about cosmetically how you look in the mirror. This is about how your spine and your nervous system are working. And if your spine is abnormal, like Daniel David Palmer said over 125 years ago, it will interfere with the nervous system's ability to communicate and control all your organs, all your glands, all your body part. And the result is you will lose your health. So today we're going to talk about the miracle of chiropractic. We're going to help you understand, and we're going to tell some stories. I brought in back to our podcast my business partners and 80 years of chiropractic experience sitting in here today, and we're going to give you some just good information, some stories, some science, some philosophy, but just some reality. If you would, welcome back to our show, Dr. Ryan Scully and Dr. Josh Bock. Guys, thanks for joining me again on the Unplugged Healthcast.
Thanks for having us, Kevin. We're excited to be here, Dr. Wall. We're got some life to share.
Well, Dr. Scully, how the heck, you're the younger of us three here. What got you into chiropractic? Why did you become a chiropractor?
It's a great question. I always say chiropractic found me. I was playing sports at a younger age and as a teenager and started to develop a lot of lower back pain, even affected my legs, my feet. And I remember one time I had so much leg pain, my dad literally carried me off a soccer field. And finally, through advice of a friend, saw a chiropractor, took an x-ray, found I had scoliosis. And I started getting adjusted and it was life-changing. Helped my alignment, helped posture, pain went away, and I was back playing sports without any pain. And after going through that personally, being also into sports, I remember watching an NFL game, and at halftime there was a commercial on, and they went through about how Emmitt Smith keeps his body healthy by getting adjusted. And between my experience seeing professional athletes get adjusted, I knew it was what I wanted to do. So I went and shadowed a chiropractor, eventually went to chiropractic college, and rest of the time been here at AFC.
Well, chiropractic has came a long way in my 37 years of practice. Back then there was a lot of discrimination, monopolization by the AMA to keep chiropractic out and keep us down. But we've survived for over 125 years. In fact, today it's actually it's part of almost all therapy sessions or treatment or protocols for professional athletes or Olympic athletes to just all the way down to moms and children. In fact, Dr. Bock, I know you had an experience when you came right out of school treating the Minnesota Vikings. So that was a few years ago, and even then they knew the benefits of chiropractic. What was that experience like?
Oh, it was wonderful to work with. When you work at that level with a professional athlete, their full-time job is ensuring that they get the best nutrition, the best, exercise, fitness, but also the best healthcare because their body is their vessel in which how they support themselves. So they took a lot of time and effort to ensure that their bodies could run in tip-top shape, and that included having chiropractic as a part of their regular care.
Yeah, it's becoming a normal thing now, which unfortunately years ago it wasn't so normal. In fact, the concept, I had a conversation yesterday, someone said it was alternative care, and I hate that word because I think alternative care ought to be pharmaceuticals. I think this is primary entry, and we got to start understanding is that you go to the most logical, the most simple thing first. If your house was hit by a lightning and you went home and your microwave and your refrigerator and your kitchen lights weren't on, you wouldn't go buy a new microwave. You wouldn't buy a new refrigerator. You wouldn't even tear out the wiring and do surgery on the walls, right? You would go check the fuse box. Your spine is like a fuse box, as when it gets shifted, it's like short circuiting the system. And it makes zero sense to replace organs and do surgery and just to override the nervous system or the electrical system. Go to a chiropractor. If you're not an athlete, that doesn't matter. If you're just someone that wants to be healthy for a lifetime, you got to consider chiropractic today is the primary portal. It is not alternative. It should be mainstream, and it's starting to become. So we're thankful for that. But let's go back to years ago, because in my practice, I know that there was miracles every day. Chiropractors are the most passionate, purposeful people you'll probably ever meet. I've met a lot of healthcare providers that aren't that excited for often what they do, but I've almost never met a chiropractor that's not pretty excited. What makes you excited, Dr. Scully, to go to work every day?
Changing patients' lives in a way that doesn't require surgeries or medication. Just to piggyback off what you just said, I mean, we see patients in their 90s in our offices and as young as a week old. So you can help people of all ages, and it's really about helping them get their life back. I think a big difference between us and, going to your primary care is you're consistently on a medication and you're talking about the pain that you're in and how you don't feel good. And in chiropractic, the blessing is we get that in the very beginning. When patients come in, they're hurting typically, they're not feeling well. But we break it down to what their daily goals that it's preventing them from, such as like hiking or going to the gym or playing with their kids or playing sports. And within a short period of time, many times within that first month, patients tell you how they're getting their life back. And it's great to share that with the team. And sometimes they'll even give testimonials, but it's very rewarding to help someone get there, realize they don't always have to be in that state of feeling bad.
You said something about treating a 1 week old. I know Dr. Bock, your kids, I think most were home birth, but I know that you treated them probably within hours. And people may think that's just crazy. Why would you treat an infant hours after they were born? What the heck, chiropractic? Isn't that dangerous?
Well, I'm sure they're you're always afraid of what it is that you don't know. And we've had some previous podcasts with Dr. Jenny that talked about treating children. But yes, I did treat my own children when they were born. If you picture the birth process, whether you have it naturally or even in a hospital setting, it's very traumatic for mom and baby. And so, there are very gentle ways to treat kids even when they're just a few hours old, and you can do so successfully to help them, recover from that traumatic experience.
All right. Well, before we get further down in the stories of chiropractic, which we have for you, they're worthy of sticking around and hearing because you may not even grasp the possibilities. But when you hear these stories, it will open your mind. Let's give them some basic information, some science really to help them understand that chiropractic's not a religion. It doesn't matter if they believe or not. The science will work with you. You can come in and tell me I don't believe and I'll still fix you because it's based on some basic principles. Here's the first one. It's called the law of homeostasis. Go look it up. It's not a myth. It's not a theory. It's actually a fact that your body has the ability to adapt to its surroundings, to adapt to the situations, to adapt to stress, to adapt to weather changes, to adapt to you name it. So I'll give you an example. If you fly in an airplane and you are functioning correctly, your body is working, the law of homeostasis is intact. You'll go up in elevation to altitudes and your ears will change based on the altitude, right? You'll feel them pop, you'll feel them release. And that is the law of homeostasis. See, your body is always adapting to everything, to temperature changes, to barometric changes, to stress levels. That if you're under barometric changes and you say the famous old statement, I can tell the weather's coming in because my rheumatism is acting up. Well, that's telling you and telling me that your body's not adapting. It's not adapting, it's reacting. And see, when your body adapts versus react, you don't get stressed out physically. You don't feel the barometric changes. You don't notice your ears even change. It happens so evenly that you don't even notice that you up and down. The reason you know your body's not working is when you go up and your ears don't pop or don't release, and then all of a sudden you're in pain and you can't hear and you're plugged up. Well, that is a neck problem. That is the law of homeostasis not working because the nerves in your neck control the eustachian tube in your throat, which controls the pressure in your ear. And so if your neck is wrong, your ears will be wrong, and you will not allow your body to adapt to its environment. So the law of homeostasis, chiropractic is based on it. And if your body's working, you can handle the changes and the adaptations going around you. Let's talk about another one. Often, Dr. Scully, people are confused. They think they can buy healing from a doctor. They think that pharmaceutical a company sells it or Walgreens has it. Where does healing really come from?
Healing comes from the body, it comes from the nervous system. Your body's in a constant phase of regeneration. If your body is hurting, if you're having joint malfunction, it's going to affect your body's ability to heal itself. So your body, controlled by your nervous system, constantly is replacing dead or dying or damaged tissues and cells. So some examples would be your skin regenerates cells optimally every, say, 2 to 4 weeks. Red blood cells, it's replacing it every 90 days. Even your stomach lining would be every couple weeks. Now, with the system that controls that, the nervous system, if it's not functioning optimally, that time frame will change, and sometimes it will never start to replace itself, those tissues. So, what chiropractic does and how it can greatly influence it, an example that I would see in a clinical setting all the time over my 18 years is patients come in with heartburn, digestive problems. And I'm not going to say that you can fix every single person, but we have a high propensity to help a patient get better because, number one, if you're just taking an antacid medication over years, it never resolves it. The tissues are never really healing, and it can lead to many side effects, such as lowered bone density. Fractures can occur when people are on these types of meds for a long time. What we do as a chiropractor is when we check the spine, if you feel in the middle back where those nerves control the stomach, a misalignment, a subluxation, the word you mentioned earlier, tight musculature in that area, and you remove the interference there, get the spine moving, remove the interference to the nerves that go to the stomach, you will see symptoms change in a very short amount of time.
So, are you telling me that you heal people? Can the doctor heal anybody?
I'm not saying that. What I'm saying is we are removing the body's interference to the nerves that control that area, and the body will take care of it.
So the body can heal itself. I always joke that what was the difference between a cow and a steak? See, if you cut a cow, it will probably heal. If you cut a steak, chances are you're going to throw it on the grill. You're not going to get that steak to heal because the difference is life. Life heals. Life's inside of you. No doctor can heal you, no pharmaceutical company, and even no chiropractor can heal you. But your body can heal itself. Healing is inside, and the doctor's job, and what the chiropractor is great at, is releasing that ability for your body to heal itself. That's why you go to the chiropractor, to get your body to heal on its own, for the law of homeostasis and for your body's natural ability to heal, repair, regenerate cells and get back to normal.
Is chronic pain holding you back? At AFC, our team is committed to your well-being. We provide holistic care, including chiropractic, physical medicine, immunotherapy, detox programs, and more. Our experts target the root cause of your pain for lasting relief. Book your consultation online or by phone and experience our smooth process. AFC, embrace a life without pain.
Well, Dr. Bock, we've heard this term vertebral subluxation. D.D. Palmer talked about it. He probably didn't understand it to the level we do today. Why don't you help the crowd understand what is a vertebral subluxation, and then maybe how the heck do you fix something like that?
A subluxation, if you take the word apart, sub like a submarine means less than or below. And the Latin root word of lux, L-U-X, or luxation, is a dislocation. So When you dislocate your shoulder, that's very bad. You tear ligaments and cartilage in the shoulder to do that. So a subluxation is less than a dislocation. It's a malposition, misalignment, simply put, of a joint. And when it occurs in the spinal column, it puts pressure and irritation, on the nervous system. And when there's pressure and irritation on the nervous system, the body's born ability, the innate intelligence of the body is interfered with, and the body can't heal itself. It's very simple. Now, how do you go about healing it? The detection of a subluxation is done several ways through palpation, feeling. The doctor would feel the spine for its normal movement pattern. You can take x-rays to determine the position of the spine in one compared to another. And then obviously, the way you correct that sort of thing is called an adjustment. Just like a cavity is fixed by the dentist, the chiropractic profession is trained how to restore subluxations, remove them from the body.
Well, that seems almost too simple, Dr. Bock. I mean, gosh, you're sure like they don't need surgery? Their body can come back. A chiropractor can just crack a spine, and all of a sudden, like this is the theory. This is the misinformation. Help people understand why it can be that simple.
Well, I think the world tends to complicate a lot of things. And so it is that simple. When you find a misalignment as a chiropractor, you restore its mobility, you show the patient stretches and exercises to rehabilitate and strengthen that area of like the weak link of the spine. You really can do a lot of great things for for the body. And so, yeah, finding a subluxation and removing it takes a little bit of know-how, application, right line of drive, and understanding of exactly where it's at. Sometimes the process does have to be repeated several times. Depends on how long it's been there and if there's degeneration in the joint, how well the adjustment holds. There's a lot of factors, but it can be done.
Well, it's one of the themes of our podcast, and why we do this is I always say health is simpler than you think it is. Food, water, and sunlight. And the sunlight, the energy in your body is the nervous system. And so when I talk about sunlight, I got to tell you, your nervous system has got to be working. There's no logic in your thought that you could function at 100% if your nervous system was functioning at 70. Do you think about that? There's no way. If you've got jacked up spines and you're expecting to function normal, I don't care what drug, what doctor you're going to, what therapist, what massage therapist that said, you've got to get the nervous system working at 100% for any chance for your body to heal itself. All right. Well, we got to get off our soapbox. Let's talk about some stories. In 80 years of combined chiropractic history here are stories. I've seen so many. I thought about this, and we could do podcast after podcast of the miracles that I have seen in 37 years, but we don't have time. Let's try to tell a couple each. I'll start with the one that I tell often. It's the story of baby Jake. Years ago, on New Year's Eve, we went to a party. It was a strange night, as New Year's Eve typically is for us. And we went to some new friends that we hadn't met, and we showed up at the New Year's Eve party, and we were the first ones there. Well, an hour later, we were still the first ones there, and 2 hours later, we were the only ones there. We were the only ones there all night. It was a little strange, unique. It ended up being a great thing because about an hour or two into it, they brought baby Jake out of the crib, who was only about 3 months old. Baby Jake had socks up and down his arms and legs. I go, what's the deal with the big tube socks covering his arms and legs? And they say, well, if we don't put the tube socks on him, he's scratching himself because he has horrible eczema. They pulled the tube socks off to just poor baby Jake had just sores up and down his arms and legs and in his body. And he was so uncomfortable and raw. It was really just painful to see for him, I'm sure. But I said to her and explained to her the concept of birth trauma and what Dr. Bock talked about early and what happens. And sure enough, baby Jake had a very unique baby delivery where they pulled him out of the canal like they do on many babies with forceps, hands, or suction cup. So I asked them to bring him into the office. That next week, she brought baby Jake into the office. We checked him out, and sure enough, he had a severe subluxation in his neck where the baby was pulled out of the canal. Well, the great news is if you get checked early, if you get your children checked early, it doesn't take long. As Dr. Bock said, many of you have been living with subluxations for 20, 30 years. Baby Jake only had it for 3 months. So I started working on baby Jake right away. I adjusted him right there that day. He fell asleep right in the room, as many babies do because he hadn't been sleeping good. He had pressure in his neck on the nerves, and how did he tell her? Well, he was colicky, he was irritable, he was crying a lot, and he had eczema. And did I fix his eczema? No, but sure enough, the body did. Soon as I started relieving that nerve pressure and interference, his body started healing itself. It only took 3 weeks, and that baby had looked drastically different. Today, baby Jake is a 29-year-old firefighter here in, I think, Mesa. He's got children of his own, and he never had eczema again after that week or after that couple of months. And those friends are still friends of ours. It's a great story, but it's one of the many stories of how chiropractic relieved nerve pressure that allowed the body to heal itself. And yes, eczema went away. Not neck pain, not car accidents. Eczema went away. So, Dr. Scully, what kind of story you got for us? Can you top that one?
This one actually, I'm thankful this happened because it was in my first year of practice, about 6 months in Fountain Hills, and her name was Jennifer, and she came in through an event that we did, and she was suffering with severe migraines for about the last 5 years. And she had gone down the medical path and was on all sorts of medications. And the reason why this one stands out the most to me is doing the consult, it was the first time I had heard that a patient was actually to the point because of their health issues where she was suicidal. She said the exact words, "I'm at the end of my rope." And man, as you know, a 25-year-old, that hit me pretty hard. And we did an exam, took some x-rays, and I could see where her neck normally should look like a C-shaped curvature. It looked like an S. And we found out in her history there was a car accident in the past, but to me, that was based on the exam, what was creating the migraines. And after a few weeks of treatment, starting with her neck, adjusting, correcting a subluxation, the migraines started to get better and better to the point where she got off all of her medications. As we were just talking earlier, the body was able to heal itself. It saved her marriage, and most importantly, it saved her life. So she was very thankful, appreciative, but it really showed me that, wow, there are health conditions that can take people to the point where they're contemplating suicide, and that taking medication after medication was giving her no answers. So I'm grateful that we were able to help her.
Well, that story continues on. I was at an event the other day and I ran into one of the family members of that family, and she now has a daughter who's a chiropractor, I think, doesn't she?
Yes.
Yeah, and she's practicing in Florida. So, chiropractic, if you are thinking of becoming a chiropractor, it's a great profession. We need you out there. So, we need you to hear these stories, not only go to a chiropractor, but to consider we need great chiropractors in our profession. So, good job on that one. That probably did top mine. What about you, Dr. Bock?
As we started to put today's topics together, I was reflecting on the miracles of chiropractic. When I was early in practice, I had a lady come in, and she was in her mid 20s, maybe 26, 7, somewhere in there. Anyway, she came in because she thought she had low back pain, which she did. And, did just our normal thing, evaluated her, took some x-rays, made some recommendations, started treating her. Well, what I didn't know is 4 times prior to meeting me, she had landed herself in the hospital because she would suffer from constipation. Not a little constipation, like every once in a while, full-blown constipation where 4 separate times she would get so constipated for days and days or weeks on end where she threw up her fecal material.
Oh, my goodness.
Yeah, and so she was so toxic. I didn't know any of this. And anyway, her and her husband wanted to have children, but she was so toxic from not being able to go to the bathroom correctly. She never was able, she could get pregnant, but she never could sustain a pregnancy because her body just couldn't do it. Anyway, started treating her lower back, and her constipation went away. And then very shortly thereafter, she got pregnant. And then very shortly after, she had her first kid, and now they have three. So the miracles of chiropractic are really fun to talk about helping people change their lives in ways that you just can't imagine.
Well, that is exactly the story of just how your body can function correctly. And when it functions correctly, crazy good things can happen. And it's simple as that sometimes. All right. Well, I got another good one. There's often a statement out there that I used to hear. I don't hear it as much, but I want to reference back to it. It says chiropractors aren't real doctors. Well, that was always funny to hear, and I didn't really care much about being a real doctor. But what I did care about was the facts that the chiropractic profession has as much education as every medical doctor out there. In fact, if you look at the school hours of pathologies, disease, anatomy, physiology, all the things that doctors need to learn, chiropractors actually spend more time on that than medical doctors do, to the point that where when they start then deviating into pharmaceuticals, which they spend a lot of time on, we go into things like nutrition and physical therapy and things relative to kinesiology and muscle function. But the basic anatomy and the teaching at a chiropractic level is as good or better than every medical doctor you've ever been to in the primary care field. And here's a story of is a story of Edward. Edward came into me years ago and he was not doing well. He could barely walk. He was using a walker. And he had been to every doctor in the book. And man, nobody could figure out what was wrong with Edward. Well, I did an exam, I did some x rays, and I saw through my exam and my understanding of a basic anatomy, there were some major problems going on here. And honestly, they weren't in the field of chiropractic. See, your chiropractor is trained to understand his scope, in or out. And I could tell right now there was something more going on. I said to Edward, Edward, we need to get an MRI. He goes, well, I've already had MRIs. I go, well, what did you have the MRIs of? Of my head. Well, the problem was not in his head. He was having headaches, of course. I knew the problem was in his neck. So I ordered an MRI of his cervical spine. It came back. Holy mackerel. He had a massive central disc extrusion to the point that the disc was putting pressure on his spinal cord right up at the top where your brainstem descends into your neck. Man, I had this guy at an orthopedic surgeon within days. That orthopedic surgeon saw the MRI, saw my referrals, and he said to the patient, you probably had 2 weeks before you were fully paralyzed. He had him in emergency surgery. He removed that disc extrusion, and within about 6 weeks, Ed came back to my office. You can imagine how thankful Edward was that I was able to diagnose what about 7 medical doctors and even orthopedics missed, never thought about, never looked at. See, chiropractors see the body as a whole. And unfortunately, a lot of doctors have been so specialized, they forgot the fact that we have a person in front of you, not a body part. Well, Edward was a patient of mine for many, many years and his family, and I treated a lot of things. I didn't treat his neck much after that. In fact, I never treated his neck, I don't think. I did treat his lower spine. I kept him walking, and he got his leg function back. He got his bowel function back. He was losing bowel function, which is the classic sign that everybody should have known was something more going on. But chiropractic is a lot more than you think it is. We talk about the simple miracles of babies, but I can tell you it goes all the way to the end of cancer prevention as well as diagnosing things that can cause paralysis.
When you're in pain, it's the little things that make a big difference. A friendly face, a warm welcome, and a plan that finally works. At AFC Physical Medicine and Chiropractic Centers, we take the time to understand what your body really needs, providing personalized care that gives you real relief. Because feeling better isn't just about treatment, it's about feeling like you again. Give us a call or visit our website to start your journey to a pain-free life.
Dr. Scully, what else you got for us?
Here's another one that really sticks out in my mind. This was with a patient over about 10 years ago, and it was another one who came in with neck pain. And I actually met her because her husband was coming in, and this was one of the workshops that we do. And we talked about some of the principles we're talking about today about homeostasis, cellular regeneration, subluxation. And I offered an examination to some guests that were coming in there. So she took me up on the offer, and the main reason was neck pain. And so we did her evaluation, but in her consult, I found out that she was so constipated, she was going to the bathroom once every 9 days. And this had been happening for the last 5 years. And it wasn't even the main reason she came in. And when we took even x-rays, you could see not only did she have subluxations in her neck, but in her lower back, and you could see the gas pockets all throughout her intestines in the entire x-ray. And so we started some treatments on her. Not only did we work on her neck to help with the pain symptoms, but we started working on the lower back. And within 2 weeks, she started going to the bathroom daily for the first time in over 5 years. And it changed her life. because not only that, the greatest stories to me aren't just helping her with pain, but it's about how it's affecting her life. She wouldn't even, because of the feeling she had in her stomach, she would go out with her husband on social events. They wouldn't go out to restaurants. It was completely affecting her life, and she got her life back because of the power of chiropractic.
Yeah, this is so common in our offices, and it sounds so strange maybe to you listening, but the miracle of chiropractic occurs every day in chiropractors right around you. You could be the next miracle. I ask you to get in to one of our clinics or a clinic near you. Dr. Bock, take us home here. What's the last story we're going to tell today?
Well, I hope it's a story of hope that I want to communicate to the audience, which is if you've been to a chiropractor before, and maybe didn't have a great experience, maybe it didn't help you with a particular thing. My personal story that I love to share was actually my own wife. We had one we had one child. We were trying to get pregnant with the second child, and it just was not happening. It just couldn't figure it out, couldn't get it down. And I would, of course, as the chiropractor, I was like, okay, maybe I'm not adjusting her correctly. And honestly, it took a referral to Dr. Wall that actually immediately helped. I didn't evaluate my wife's spine and structure. He looked at it differently. So if you're struggling with a health problem, you've been to a chiropractor and maybe it didn't work out or the problem didn't resolve itself, please don't give up on the profession. Just try a different chiropractor. Maybe they have a different approach or they're going to look at it a little differently because within 30 days of him treating her a couple times, we now have a second child, and I'm very grateful for my good friend, Dr. Wall.
Well, I forget about that story often, and I'll take it, but I'll take it for the profession of chiropractic. I had many stories, and we don't have time to tell them all, of women that came in for back pain. We treated the same exact thing that I treated in your wife, and they were able to work. Their ovaries worked again, which is the nerves to your ovary, comes from your second lumbar vertebrae. A lot of people have given us credit for pregnancy in chiropractic. It's a phenomenal profession. What a great way to live. What a great way to treat. What a great job to have for 37 years. So, well, Dr. Scully, I just want to have you wrap it up. If people are hesitant to go to chiropractors, I think Dr. Bock already told them they ought to consider maybe if one chiropractor didn't fix them, try another. They do that in every other profession, right? One mechanic doesn't fix your car to go to another one. But you've been to one chiropractor, he didn't help you, never go again. Makes no sense. But a lot of people have fears. Maybe they've heard things. What could you say to people to get them over the hurdle to try chiropractic and start believing like we do?
Well, I think the two most common things I've heard is just what Dr. Bach was saying. Maybe you have a thought process that, or you've heard from a friend or personal experience that maybe chiropractic doesn't work or could potentially not be safe. I know that in all of our clinics, the first thing that we do is we have a conversation because if you don't take a proper history, there's definitely things that you could be missing. And some people, it's not chiropractic's not for them. We understand that. But for the ones that are, you go into an exam, and a good chiropractor is very thorough in an exam. There's certain tests we'll do, certain movements. You palpate and feel the spine to detect a subluxation. When you find that, the next logical step on the majority of people would be to take an x-ray. And we do that to make sure not only it's safe and effective, but that you can be very specific with treatment. As Dr. Wall was just saying, when you're adjusting, there's all different ways to adjust an L2 lumbar, but if it's not done correctly, you're not going to get the results that you want to see. So just like any profession, there's good and bad teachers. In my mind, a good chiropractor does that. The other thing is sometimes it's about time, or I've even heard once you go, you always have to go. I know in our clinics, what we do that's unique is if we can help you, we tell a patient and go through that there's always a start and an end. And at the end of that, many people choose because of how it changed their life to maintain it. And that's okay because you wouldn't buy a Lamborghini and never get the oil changed. So in the same perspective, when your body starts to heal itself to keep it functioning and regenerating that optimal amount of time, it's good to get a checkup that a chiropractor can do. But a good one gives you a start date, an end date, and keeps you knowing along the way how you're progressing.
Well, there's definitely good and bad in all professions. I just want to encourage all of you that the miracle of chiropractic isn't a belief, it's a truth, it's a science, and it is applicable to you. Many of you are out there suffering, taking medications, doing drugs, doing nothing, sitting home hoping that it get better. But the one thing that I have seen with time and trauma is that it gets worse unless you get to the root. But the great news also is that at any age, from a 2-day-old baby to a 100-year-old grandma, that your body can heal itself. It never stops repairing itself. It never stops regenerating itself at all ages. So don't give up. There is hope for you. There's hope for your health. And that's how we always finish our podcast. As I sign off here from the Unplugged Healthcast, give hope, give health, and never give up, never give in. And we'll see you again in the future on an Unplugged Healthcast. This is Dr. Wall, Dr. Bock, and Dr. Scully, and we're signing off.
The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.